This program was created by the Quillen College of Medicine Library at East Tennessee State University. Funding was provided by the National Network of Libraries of Medicine. Ask a focused clinical question. Usually, most patient cases raise a wide range of questions that might be pursued. Generally, clinical questions can be conceptually divided into two main types. Background questions ask for general knowledge about biologic or other fundamental aspects of an illness, whereas foreground questions ask for specific knowledge about managing certain aspects of the care of a patient with a specific condition. In fact, all questions are not created equal. Some will have a greater or more immediate impact on patient care and simply must be considered first. When raising a question, we should consider the following. Which question is most relevant to the care of the patient and is feasible to answer within the time available? And which question is most likely to come up again in the care of other patients? To ensure we get answers that apply to our patients, we need to focus our questions with more detail so we can efficiently and effectively use the resources of the medical literature. One approach is to frame our clinical questions using the PICO components. In this framework, most questions have four components: P, patient, population, or problem of interest. How would you describe a group of patients similar to yours? What are the most important characteristics of the patient? This may include the primary problem, disease, or coexisting conditions. Sometimes the sex, age, or ethnicity of a patient might be relevant to the diagnosis or treatment of a disease. I, intervention, exposure, or prognostic factor being considered. Which main intervention, prognostic factor, or exposure are you considering? What do you want to do for the patient? Prescribe a drug, order a test, order surgery? What factor may influence the prognosis of the patient? Age, coexisting problems? What was the patient exposed to? C, comparison, if applicable. What is the main alternative to compare with the intervention, exposure, or prognostic factor? Are you trying to decide between two drugs, a drug and no medication or placebo, or two diagnostic tests? Your clinical question may not always have a specific comparison. O, outcome of interest. What can I hope to accomplish, measure, improve, or affect? What are you trying to do for the patient? Relieve or eliminate the symptoms, reduce the number of adverse events, improve function, or test scores. A question in PICO format can help to specify your question and identify search terms. Scenario: Mr. Smith had hepatitis C and cirrhosis. Histories taken during recent visits suggested that Mr. Smith's cirrhosis was stable and physical examination revealed no evidence of ascites or encephalopathy. However, your notes remind you that much of Mr. Smith's last visit was spent addressing his debilitating fatigue and discussing his fear of liver failure. As his primary care physician, you want to address his concerns about treatment and help him understand how the most recent research findings might apply to him. The CI consultant indicated that combination therapy with pegylated interferon alpha and ribavirin is the current standard of care for treatment of hepatitis C. Example of a question in PICO format. P, patient with hepatitis C and cirrhosis. I, combination therapy with pegylated interferon alpha and ribavirin. C, no treatment. O, effectively reduce morbidity and mortality. Our clinical question could be, in patients with hepatitis C and cirrhosis, is treatment with pegylated interferon alpha and ribavirin compared with no treatment effective? This concludes the presentation. Thank you for watching.